Hi everyone, welcome to researchmd.com. We got a great presentation today. Today we're going to look into a very important melatonin, and we're going to teach you how does it help in sleep. Again, my name is Pramil Cheriyath. I'm a program director, internal medicine residency, transitional residency. I'm a director of research. I teach medical students and medical residents. I'm also also an assistant professor of medicine, Hackensack School of Medicine. So let's jump into our subject. Okay, so introduction is all about where does it produce from. Okay, it's mainly produced in the brain. This is called pineal gland, remember that. But it can also be produced in if I say like a gastrointestinal tract. Some studies have shown it produces more in the gastrointestinal tract. That's what I think happened when we eat a lot of food, we sleep because there's a lot of melatonin probably. It also produces in the retina, bone marrow cell, platelets, skin, and the lymphocytes. So how does the body make melatonin? That's the next step, okay? It's synthesized from an amino acid called tryptophan. There's this enzyme called tryptophan 5-hydroxylase that convert tryptophan into 5-hydroxytryptophan. And then that is converted into serotonin by the enzyme aromatic levoamino acid decarboxylase, okay? And once you have the serotonin, it's converted into N-acetyl serotonin by serotonin N-acetyl transferase, which is also called thyme enzyme. Okay, and then this N-acetyl serotonin, by the action of hydroxyindole O-methyl transferase, is kind of converted into melatonin. So we get the final product, melatonin. Just remember the synthesis. How does the body make melatonin? So it actually comes from the amino acid tryptophan. So what happened? Mainly thing you have to know, the effect of darkness. So this is probably a Dracula effect, I would say, because when the sun goes down, you got this retina receptor. They start sending luminous information. Where is that information going to? It's going to hypothalamus. There is suprachiasmatic nuclei, and from there information is going to go into pineal gland, and pineal gland starts secreting melatonin. Okay, that is what happens. So if the light comes in, there is an inhibition there. So actually what happens, so in the dark it gets stimulated. It works in the dark. So it's a Dracula effect, I would say. Okay, so once the sun goes down, the retina send luminous information to hypothalamus, and the hypothalamus send information to pineal gland, and the body starts producing melatonin. How does this, what is the mechanism of action melatonin? Okay, there's two types of mechanism. One is a receptor-dependent mechanism, and the other one is the receptor-independent mechanism. What happened? The receptor-independent mechanism is not our subject today. It affected the oxygen radical formation and all those kind of things. So today we're going to focus for this, our purpose is how melatonin help in sleep. It work on the receptor-dependent mechanism. On the receptor-dependent mechanism, there are two types of receptors you have to know, ML1 receptor and ML2 receptor. And on the ML1 receptor, there's MT1 receptor and MT2 receptor. Those are the major players in this thing. They, through G protein coupled receptors, they inhibit adenyl cyclase. And the effect is going to be on circadian rhythm, the body's own 24-hour clock, and it affects the sleep latency, and it also produces fatigue, so we usually kind of go to sleep, okay? So this is the mechanism of action on the sleep and the melatonin. This is how melatonin is produced, and this is how they make us go to sleep. Thank you so much for watching. Will be more presentation on melatonin. And if you have any questions, please put it in the comments. And thank you so much for watching. Please subscribe our channel.